The World Health Organization has called on China to provide more data on its COVID-19 cases and deaths. The World Health Organization's chief's request came hours after China announced that nearly 60,000 people have died from COVID-19 since the abrupt dismantling of the country's controversial zero-COVID policy. Health officials say more than 90% of the deceased patients were 65 years and older. Beijing claims that there has been a steady decline in the number of visits to medical clinics in the last few weeks.
Since 2020, China has always insisted on classifying deaths with a positive test result for nucleic acid test as COVID-19 related deaths. This is basically consistent with the standards of World Health Organization and other major countries. The attribution analysis of deaths related to COVID-19 is divided into two categories. One is the death due to respiratory failure caused by COVID-19. And the other is the death caused by underlying diseases combined with COVID-19.
For more on this, Dr. Bharat Pankhania joins me now live from the UK. He's a senior clinical lecturer at the University of Exeter Medical School. Thank you very much, Dr. Pankhania, for joining us here on TRT World. Now, 60,000 deaths since early December. Okay, that's a significant number, but maybe not too significant when we look at the entire population of China, which is in billions.
No, I think the 60,000 is what we are hearing. China has got a very narrow definition of COVID-related deaths. They are only counting respiratory failure and respiratory pneumonia as a COVID-related death. They are not counting other deaths. So in my opinion, the figure for China is much, much higher.
And Dr. Pankhania, certainly what's happening in China right now has raised many concerns about the coronavirus pandemic across the world. What do you think would be the likely impact of the surge in COVID-19 cases in China on the rest of the world?
So the rest of the world, especially the rest of the world that have been heavily immunized and boosted with the better performing mRNA vaccines, are in a much better position. On the other hand, countries like India, neighboring countries like India, where their uptake of boosters in their vulnerable age group has not been that extensive, I am concerned. Similarly, other countries surrounding China, where again, they haven't had a huge uptake of booster vaccines with the higher performing vaccines, the mRNA ones, I do worry about it.
Dr. Pankhania, if you were advising the Chinese government, what would you tell them?
So they have advised, they have immunized their younger groups and are now catching up with immunizing their older groups, older age groups. So my advice would be, look, you need to protect your elderly population because they're vulnerable. Keep them secluded and out of harm's way until they have been immunized. And then the second bit is, please swap from using your Sinopharm vaccines to the better performing mRNA vaccines and use the mRNA vaccines.
All right, Dr. Bharat Pankhania, it's always a pleasure speaking to you, sir. Thank you very much for talking to us here on TRT World.